as a whole.
Yeah, I think it's always a great meeting, the Scottsdale meeting. And unfortunately, this was, I forget if it was the 70th year, but it's the last year that the Headache Scottsdale meeting will actually be at the Camelback Resort. So there was a lot of just emotionality about being at the last time that they're going to have. The Headache Society has grown so large that the beautiful Camelback Resort is no longer really able to accommodate everybody, but so it's a great place to have it though, and Scottsdale is always great to travel to. But it was great to meet headache experts from all over the world that were joining. We saw a lot of new interests, a lot of trainees attended. There was a lot of advanced practitioners. And so it's really great to see the scope of headache medicine expand. Some of the main themes, I was lucky enough to participate in the pre-courses where they have some of the regional headache societies discuss some of the new advances or understanding of migraine treatments. There were some nice courses taking a look at DEI in migraine and health and how this is one of the initiatives of the American Headache Society as well to increase research along this area. Also, a lot of women health issues, and of course, a lot of new exciting things. Just knowing how the newer migraine treatments that target CGRP are being used in clinical practice now. Okay, so I was part of our Great Lakes Regional Headache Society, and we had a pre-course where we showcased some of our uh, physicians that have expertise in headache medicine in the Great Lakes region. And so our pre-course was looking at migraine as a systemic illness, really recognizing that migraine is not a neurologic disease, but we often see it with other comorbidities and really as part of a systemic illness. My focus was really taking a look at the interactions between migraine and metabolic disorders. It's important to look at is if we can address some of the metabolic disorders that we see with some of our patients, we do have the opportunity to improve the health of our migraine patients, not only in prevention of some of the risks of developing cardiovascular disease, cerebral vascular disease, even Alzheimer's disease, but we can also decrease the burden of migraine as well. We take a look at how, prevalent migraine, obesity, and diabetes are, and they're really kind of high health crisis right now. We know that obesity and diabetes are at pandemic levels, and migraine, we know, is the top two disabling conditions globally. And under the age of 50, it's number one for the number of years lived with disability. And I think we have to take a look at not just addressing one thing, but how do we address all things to improve the overall health of our patients. But there is some interest in using these GLP-1 agonists that are used to treat obesity and primarily diabetes, but also being used now to treat obesity, but taking a look at those to look at how they can help modulate pain. We may see some information down the road with those therapies as well. No, I think there's a lot of research that is going on with some of the CGRP antagonists as well, looking for special patient populations, such as menstrual migraine. There's also new neurotoxins that are being developed as well, taking a look to see if there may be additional benefit in people with migraine, and also taking a look at the neurotoxin botulinum toxin that we've been using and seeing can it be utilized too in a different patient population other than chronic migraine. So it's a great time to be in headache medicine as the advances have come out and patients have you can see the dramatic impact that it has on patients, which has been great. Yeah, so next year it will be at the Scottsdale, I think, Weston. So a little bit further, a little bit distance away, but it still will be, I'm sure, a great venue. They put a lot of time and effort in planning it to make sure that it really meets the needs and has such interesting topics. And I love the fact too that they have so many different speakers each time, which has been great. It's a great time to get together. They have a lot of social activities too, which it's I think one of the most valuable things about meetings are just the networking, making connections, collaborating on projects, and just knowing who one another are, and promoting some of our newer, younger staff, which is great as well.